And good morning, Ontario, PSWs and friends. My name is Miranda Romanovich. I'm the CEO of the Ontario Personal Support Workers Association and host of PSW Podcast, where we come to you guys live every single Friday, sometimes at 10:30, like today, normally at 11 o'clock. But today is a special PSW podcast. I'm joined by my Chief Operating Officer, Ian De Silva, of both the OPSWA and the CANSWA as well. And we're here today to talk about the HESCAPOA, which is the Health Providers Oversight Authority. I can never say it's such a long word, it's such a long sentence. But we're here to talk about the new pseudo regulation of personal support workers in Ontario. And so yesterday, Ian, on our Facebook, and our Instagram and through email marketing, we shared information directed at personal support workers who graduated before 2014, and the impacts of Pathway 2 with the registry HESCAPOA, and the impacts that it's going to have on the PSWs that graduated before 2014. We're going to do our best today to explain it to everyone here so everyone doesn't panic, and to understand that the association is actively working with the HESCAPOA on this issue and hopefully rectifying this in a short amount of time. Hopefully. Hopefully.
Right.
So let's talk a bit about the HESCAPOA, Ian. Let's get it going.
Absolutely. So the Health Support Care Providers Oversight Authority is basically the preamble to the professional regulation of personal support workers in Ontario. They're very much, we all are hoping to have a mandated regulatory structure in place sooner rather than later. The issues that we're dealing with is the manner into which the regulations are being presented and the impact that's going to have on the PSW population, and more importantly, how it's going to impact care levels in Ontario as these regulations come to fruition. So as they become more enforced and as they become more widely enforced. So the real issue we have is coming to do with the different pathways that are available and some of the probably, what's the word, unintentioned uh, consequences that's going to happen for some of these individuals. And I don't mean to make light of it. It's not that at all. It's how to phrase this right. So essentially what we're seeing right now, and do you want me to get into it or do you want to jump in?
Go
Okay,
for
so
it.
what we're seeing right now is that the way the regulatory structure has been set up is it's created several different pathways to enable personal support workers in, we're just talking about Ontario for the benefit of this. So personal support workers in Ontario to join the health support care providers oversight authority. So the primary one is if you graduated after 2014, then there is a process for you to follow and you're able to join the HESCAPOA, no problem. However, the issue that we're coming up with is the PSW graduates prior to 2014. So the way the regulatory structure is laid out, it basically indicates that if you were a graduate of a PSW program anytime prior to to 2014, then you're going to require proof that you're going to require proof from your employer that you were actually a PSW. So this is going to give employers a lot of say over who is and who is not a PSW, especially that older group that's went through the COVID, which is very questionable. The further to that, the employer pathways further restricted because only certain employers are considered eligible to participate in that pathway. Now we're working to secure a list of that. We don't have it yet, but we're working on that right now. So what we're seeing is a large gap developing of PSWs that are caught in that gray area. So Miranda, take it away. We've talked enough.
Oh yeah. So basically what it is that if you graduated before July 1st, 2014, if you are actively working with an employer, and if this employer is one of the preferred employers with HESCAPOA, then they can fill out a document that states that you know what you're doing as a PSW. Now, for the PSWs that are working for the employers that are not on this list, unfortunately, that avenue is not there. And if you're out of the field and looking to return, that's also an issue. So one of the biggest issues we've been seeing, and why we brought this up, is because the association has been inundated as of late with emails from our members and PSWs, just regular PSWs in the public, that are going, I went to a job interview at a long-term care facility and they told me that my certificate is expired, that my certificate is not valid, and that they cannot hire me to work as a PSW. Now, this is untrue, okay? You actually are able to, still work as a PSW. It should still be valid because the cutoff point for this pathway, which is pathway 2 with the HESCAPOA, is actually December 1st, 2027. So your certificate is still valid, and this is our time, our length in time that we have to fix this issue. It's still valid till December 1st, 2027. Now, for those of you that think this does not directly affect the association, you are wrong. I am a personal support worker graduate of Mohawk College of 2006. And just because I have not worked in the field for the past decade, that means that I right now would have to go back to work with a preferred employer in order for them to say, yep, Miranda knows what she's doing. And I find that unfair. I find that very unfair. Our director of operations, Nicole Crawford, she is also a PSW graduate of 2012. Same situation there. So we're really on the fence about this. We have definitely expressed our concerns and had very positive conversations with HESCAPOA surrounding this. They do understand that this may have been a loophole that they did not think was going to become an issue for PSWs in Ontario. But I just want to make clear to everyone that this was not us. We're not the ones that put this pathway forward at all. We never would do that. And HESCAPOA did this with well intentions, not realizing that the employers would grab this and run with it. Because a key point, Ian, to all of this is it's not mandatory. The HESCAPOA is not a mandatory registry. It is still voluntary.
Yes, absolutely.
Still voluntary. So you guys could be in a situation, which we know some of our members have been in a situation where their employer has decided on their own that all of them have to go back to school to become a PSW again. They're putting them on leave of absences and they're sending them back to school. From someone like myself who did the training in 2006, I would be highly offended, and I am highly offended, that they would say I have to go back to school. We are talking about our veteran PSWs. We are talking about the individuals that went through COVID, that fought through all of these different outbreaks, SARS, everything. These are the individuals who have been loyal and have been on the front line for anywhere from 15, 20, 25, 30, 35 years. And now we're telling them that their education is nothing and that they may or may not qualify to be a PSW in Ontario.
It's remarkable. It truly is. It is a remarkable gap in what we're trying to do when it comes to public protection, especially in that regard. But highlighting the point that these are COVID warriors that are now going to be targeted, mostly a lot of them, for absolutely no reason. And I also want to highlight that the fact that this could be interpreted in many ways, and it could even be interpreted as an overreach by government powers. The real question is, does a government agency, a third party, a standalone agency, have the authority to override the value of certifications issued by the Ministry of Colleges and Universities? So
Yes.
that is the question that we have. Now, if this happens, where does that stop? So yes, right now it's the PSWs, right? Because the regulations and it's a non-regulated workforce, even though the regulations are trying to work in kind of in tandem. But I think what we're looking at is how where would this end? What powers does this give the government in terms of validating or invalidating education going forward? Does this threaten, will this in time be extended to include degree holders, nurses? Like what happens if you're someone from like, there's a lot of disconnect here with regards to this overreach. And I think that's something that we really want to highlight is that it gives enormous powers to private employers, especially those who we are struggling to determine who they are. That's the issue. And they're enforcing rules that they don't have to, which is another issue. So it's a very big concern. It's a huge concern, and it impacts more than just the personal support workers. It impacts anyone who's been educated in Ontario with a Ministry of Colleges University
Yep.
certificate. It impacts
I'm seeing some questions coming in right now,
oh,
and
sorry. Yes, please.
yeah, no, Hannah Perka, you are bang on. Is this going to cause a staffing crisis?
Oh,
This
absolutely.
is going to be a staffing crisis like we've never seen. I mean, let's
Absolutely.
be honest, we've been in a staffing crisis for as long as I can remember with PSWs, but this would, I mean, we're estimating approximately anywhere from 40 to 60,000 PSWs will be affected by this.
Oh,
That is
yeah.
a very, very large number of PSWs
Absolutely.
that, if you can imagine, are suddenly going to go poof out of the system. And who's going to be there to care for our loved ones and the most vulnerable in Ontario? Another person stated, Virginia, she said, as a graduate of 2004, my experience should account for something. Bingo.
Well
You
said.
guys are the ones that are training the new PSWs. You guys are the ones that have been through hell and back with all the different pandemics and so on and so forth. You guys have been the ones that are on the ground and have been that example for all of the new PSWs coming in. So I agree, absolutely. Your experience and your time on the ground as a PSW, that is something that should be recognized. And the way that this pathway two is set up, and again, well intentioned by Hescapoa, this was not meant to create such a huge, freak out in Ontario, but rightfully so it is, because now they're telling us our certificates mean nothing if we graduated before 2014. So, that needs to be recognized, that these people, these PSWs, have been the front runners for decades.
And what stops them from changing the program standard in the future to 2017?
Absolutely nothing. Absolutely nothing.
And that's the problem. The goalposts can be moved at the whim of the administration, just moved. So it depends on when they want to have it validated. And the other impact, you can see why, what the other threat of this is. If you're most industries value, you try to value your more experienced employees, the more time you have in there, that's the employee you want to keep. That's a retention issue.
Yeah.
Retention is a huge part of health, human resources, strategy planning. So it runs contrary to what the Ontario Ministry of Health is trying to do, at least their mandate. Um, but also it puts these PSWs in a strange position, especially employers. If you're a private employer and you have shareholders to whom you are accountable for, which most private employers do, the goal is to increase your return on investment. One of the biggest expenses we have, or you have as an employer, is that PSW, that frontline healthcare staff. The more senior staff, the more you have to pay. If you suddenly have that ability to remove that senior staff and suddenly say your seniority is now gone because your degree by this regulation, your diploma is now not worth anything because I don't have to value it. I don't have to. Your salary, we now consider you an entry level PSW. You can go back to school, which means you may have to get OSAP, but that's okay. There's OSAP available, so that's fine. Um, and then you can start at a junior salary again. After
Yeah.
20 years of work, that's what employers are positioned to do in Ontario right now. So,
Yeah, and so what we're hearing from PSWs then, Ian, is they're going to leave the field. You're going to make me go back to school to become a PSW again, do
yeah,
it like learning again. Like I talked to this this healthcare aide actually from Alberta who came to Ontario. She has like oodles of years of experience in Alberta, comes to Ontario, has to do the PSW program all over again. She says, I am just whizzing through this course. She goes, it's the easiest thing I've ever bloody done. But that's not the point. The point is she had to pay $5,000 in order to go back to school in order to work as a PSW in Ontario. There is some real disconnect and the system's broken when it comes to PSWs. And there seems to be this real kind of gnawing need to control the personal support workers. And, anytime that we seem to get any sort of leadway or headway when it comes to changes or legislation or regulations and so on and so forth, there's always something that puts up a blocker. Because I'll be perfectly honest with everyone who's watching this. In the beginning, we honestly did not think there was an issue with Pathway 2. It's when it was brought to our attention by by some of our members that we actually really looked at it and then kind of freaked out. Not gonna lie, I kind of freaked out because I'm like, what do you mean that my certificate that I worked my tail off for as a single mother back in 2006, and it wasn't easy, is now going to be not valid come 2027. That is unfair. That is something that I know the HESCAPO wants to rectify. And so, I mean, that's a positive thing in PSWs is the fact that your pseudo regulator does want to rectify this problem and find another way to ensure that everyone is up to their own, up to snuff, basically. Which, I mean, you guys are all going to be up to snuff. Let's be perfectly honest. But our idea to Hescapoa is to do like a quick refresher online or a quick test online or something like that. If this is where the regulations are going to go, you can't fight legislation. It's very hard to fight legislation. And when those regulations are put in, it's very hard to fight it. So our goal is to find some workaround that's not going to, number one, kill you guys financially, number one. Number two, enable you guys to continue working your jobs. So not losing your seniority, not losing your positions, but also, provide that necessary information to Hescapoa. So that's kind of what we're hoping
That's
anyways.
it is a very dangerous. I mean, the devil's in the details with this regulation. And again, my concern is the extension and the potential overreach of power in this regard. It's frightening that a regulatory structure can undermine the value of study and the value of earning a certificate in Ontario. Now, Ontario is where we attract thousands of international students to come to Ontario to take our college programs, to take these courses. We encourage them to become PSWs. They take these skills away internationally. The moment our own government starts invalidating the certificates issued through the MCU in any way, shape, or form, at least for healthcare, what value is our MCU products to the international community or to anyone in Ontario at that point? This is the issue that we're dealing with. It extends outward from just PSWs to other issues. It becomes a question about what is happening. So I think that's the concern that we're having. It impacts a lot more things in Ontario than just the PSW. It impacts, of course, the patients is one thing that we are really concerned
At
about.
the end of the day, that's what I was speaking to someone yesterday, and that's what I said to them was, at the end of the day, this is about the patients.
It is.
It's about the
Well,
residents, about the clients.
the nurses are starting like us. We're advocating for ratios in long-term care. Any advocacy for ratios for nursing and long-term care will be moot until this issue is developed, until this issue is addressed. Because what we're going to see is a massive retention issue. There's going to be morale issues that are going to be going down. There's a lot of, again, questions about the legitimacy of this pathway is going to be a concern. It's something we need to work on. So, yeah, there's
There's a lot of fights at OPSWA that a
there's a
lot of
lot
you
of
guys
fights,
don't
right?
see. A lot of things you guys don't see behind the scenes that we do on the daily. That's why Ian and I look so tired. Because we're constantly fighting for you guys behind the scenes. And it's not an easy change. It's never an easy change. I am happy to say that politically, this government really supports the PSWs. Not sure on the bureaucracy side, but on the political side, they definitely do support PSWs. So we're really going to be looking to tapping into that support as well moving forward, to bring this plight, really to the top, because it is a plight. It's an issue. We are on the brink of a major crisis if this does not get rectified, and
Okay,
rectified soon. What about the DSW? The DSW, you are untouched currently unless you work in a long-term care home or for a public home care provider who requires you to be registered with the Hescapoa.
yes.
Then
DSWs,
then DSW, I don't know what they're going to do with you. That probably would be a pathway too.
that would probably be a pathway too. I think the DSWs we used to be done regulated through the Board of Trades, I think a long time ago. But now the DSWs have been they're now under, we actually represent DSWs in Ontario. Forgive the actually, we represent a lot of DSWs in Ontario. They're an enormously important workforce. We don't talk a lot about DSWs in Ontario, and that's another area that we really got to shout out for because it's a huge area and they do a ton of work. And
Oh, absolutely, they do. And then what the issue is that we only have a smaller number of DSWs that we represent versus PSWs.
yeah,
So PSW kind of takes, but just no DSWs. And when we're talking PSW, we are talking about you as well. But
yeah.
yeah, I mean, that's the nature of this as well, too, is like, what about home support workers? What about healthcare aides? What about, supportive care aides? What about resident care aides? What about, I mean,
Well,
there's,
yeah, that's a good question because the Ministry of Health itself will generate new titles at whim. So how do those titles reconcile with the HESCO? It's like you don't know what's going on, right?
yeah,
So
so half the time, guys, it's literally like a minefield. trying to navigate the PSW world as it is, especially as your association, because we're constantly fighting against new titles that come up that they want to take your place. A PSW is a PSW is a PSW. You're a PSW. And, and if in your workplace, if they're calling you something different, you got to fight to be called PSW because that's what you are. So really at the end of the day, the HESCAPOA thing, your certificate is not null and void, not until 2027. Hopefully, fingers, toes, eyes crossed, we are fighting this like crazy. Hopefully that we come up with a solution. My goal is to come up with a solution before December of 2025 so that we can really stop any sort of crisis from even occurring. And I know HESCAPOA is on the same page, which is a positive, guys, because in the past when we've had to deal with similar situations, we weren't actually working with the government, and now we are.
It's true. Yeah.
So that's a really big positive. And the fact too that they recognize that this could and is going to become a massive issue in frontline healthcare across
Oh,
Ontario.
huge. This is a ticking time bomb that we're just waiting. That's going to start. That's already ticking away. So we really do need to remedy the situation at once.
So we have some questions here.
Okay.
The first question is from Elizabeth. Will this live be available to rewatch? Absolutely, it will be. Carly, our marketing director, will be putting this out. The second one will be, if you work in a unionized facility, can they still do this?
Yes.
Yes, absolutely, they still can. The unions actually are actively fighting the HESCAPOA. They don't like it either. So funny enough, we're all on the same page. And the last one is, what about PSWs in hospitals? You're still affected. Absolutely.
Absolutely. Yeah. So it is impacting every sector. Um, don't and it will, as this regulation becomes more entrenched, it will impact other sectors across that are we currently not being impacted.
So
So
we need to stop it now. So the I guess the call of the day is don't panic,
okay.
don't freak out. And for right now, it's a just stay and watch. We will be possibly doing things for lobbying when it comes to this and advocating against it. So stay tuned for that as well. We may be doing that as well. There's everything right now is kind of up in the air. When we put out the post yesterday, in all honesty, guys, we did not expect it to blow up the way that it blew up. And the part that we realized because it blew up is HESCAPOA has not communicated this out to the PSWs at all. They've communicated it out to the employers, but not the PSWs. And this should have been communicated out a very long time ago to all the PSWs across Ontario. So hopefully we can, fix this and hopefully that it doesn't happen. But this is true. I actually asked one of our moderators on Facebook and TikTok to please put the link for the HESCAPOA Pathway 2 in the TikTok and in the Facebook here so that you guys can actually go look at Pathway 2 on the HESCAPOA website. This is not our doing. We are only the messengers, so please don't shoot the messengers. But we're also sharing with you that we are not unaffected by this either. There's two PSWs that work with the association that both are before 2014. So we are both, Nicole and I are both directly affected by this. And this is going to be a ride. I mean,
Okay. It's a
it's
good fight. It needs to be corrected. This is intolerable for the system, and the system can't handle this. It's not fair. It's bad government. I mean, this is what we're dealing with. This is extremely bad policy. Not intended, but it's what we have. Um,
Yeah,
yeah,
it was all well intended. I mean, HESCAPOA
well,
was just trying to do the best they could do, and they just fudged this part up and didn't realize that it would have this big of an impact
so
on the people of Ontario.
So with regards to lobbying efforts, what we are looking, and we're still trying to get to assess the situation, but we are looking at doing providing direct outreach to members so they can contact their local politicians just to bring this issue to a bit more of a in a more constituency level, so that we can make sure that those individuals in the legislature are more aware of it. So stay tuned from us, at least from our side on this that one.
Yeah, stay tuned in from with our podcast, with our communication over Facebook. If you have not subscribed to our website, please do that. You don't have to become a member, but you can subscribe to our mail list so that you get information that way as well. We're also on TikTok, so you can follow us on TikTok. where actually I go live about 3 times a week. So I'm always happy to answer questions and concerns or whatever that you guys may have. But remember, at the end of the day, we're not going to have a solid answer for you guys right now. There's no solid answer. This is the way it is right now. So we're going to let that all seep in. And it's okay to be angry. It's okay to be pissed. It's okay to not be happy about it. I'm not either. So, but we have to keep our level heads and we have to just move forward and we have to advocate and lobby and work with Hescapoa. And thankfully, that's what we're doing. So,
We just don't want this to become a precedent.
yes, we just don't want this to become a precedent. I no, it will not. I won't let it happen. Neither will you, Ian. So, all right, guys. Well, if for those of you that are watching on TikTok, stick around. We're going to pause the TikTok for a little bit so that we can get it reset up so that I can speak to you guys there for Q&A. If you're here on Facebook, you're welcome to join us on TikTok for a Q&A right now with me. That is, we're at OPSWA or Ontario PSW Association. You can find us on TikTok, so you can join us there. Ian, again, I hate having this conversation, but it had to be had. And I think we did a pretty good job of explaining it. I hope we did. Remember, guys, if you have any questions, you can always reach out to us on our website, through Messenger here on Facebook, or of course through TikTok. So we're not hard to find as an
And
association.
we are still compiling information on this. So any PSWs that have discovered that they're impacted, please reach out to us immediately so that we can identify that population and support them.
Yes,
Again,
please reach out to us if you're impacted. Please reach out to us.
please.
Okay, guys. Ian, again, it's always a pleasure doing PSW
Likewise,
podcast with you. And we're going to say goodbye here, but I'll see you on TikTok in about 3 minutes.
take care.
Thanks, everyone. And with that, we say,
Ops
Ops out.
out.